All right, welcome everybody. I think we should start now. Thank you so much for joining us this afternoon. We're going to be talking about introduction to risk and crisis communications. Can everybody hear me okay? Just please send a comment if you have any challenges with the audio. But in the absence of that, I think we can start. My name is Emilia, and it's a pleasure to share and to have the opportunity to engage and discuss with all of you about the subject of risk and crisis. I'd also like that we observe a few house rules. If we can please put all our microphones on mode so that you can hear me clearly and others can hear me as well. Now, in the absence of any moderation from the host, where you need to ask questions or share your thoughts, I'm sure that you can unmute your mic or your mic will be unmuted from the back end and then we can all hear you. So this afternoon, we're just going to look through the subjects of crisis and risk communications, and we'll be sharing just two modules. Afterwards, I will share some recommended text as well, reading text for you. In the course of this session, we'll look at a few case studies. I hope we can get to discuss at some point. And then we would also take group tasks. Now that may be tricky. If we have time, we'll be able to do that. If not, we'll plan better for that at the next session. So this is just, a few ground rules. Usually this slide is a constant in all training or facilitation slides that I put together. I'm not sure how this helps with social distancing, but I'm sure there's some things we can still learn from it. Please, I would love to hear your thoughts. Even if you don't want to share, you can send us a message, you can send me a chat or send to the group, just so that everybody has a benefit of your experience as well. There are a few case studies here that might be controversial. In some cases, we might have different views. I'm looking forward to those, and I hope that we'll be also willing to share. Who else is here? I see 23 participants. I know many more will join. You can put this in the chat or comment section, what your name is, what you're passionate about, the kind of work you do at the moment, and what you'd like to learn from this session. This would also help us when putting together subsequent sessions so that we're able to help you meet your objectives and really talk about the things that you'd like to hear. A bit about myself. My name is Emilia Asim-Ita. I currently work as a practice director for AML. AML means A-Line Media Limited. It's a communications group. We have a few interesting, should I say, subsidiaries or arms that work on sustainability and CSR through impact partnerships. We have a brand studio. We do corporate events. We publish, and we also do public relations. So in a nutshell, that's what we do at AML. We have recently launched a learning brand, and that's called Infovore Learning. I consider myself an Infovore, and this is really to help people have personalized learning experiences. We find that trainings are no longer adequate. It's not enough to put people in a room and say you're training. How do you really make it a learning experience for them, one that they remember? I'm really passionate about learning, meeting, and connecting people. Um, that's second to coming up with crazy ideas. I've worked in the space for about 15 years, working on different areas. So I can say my experience cuts across sustainability, CSR, environmental and social risk management, a bit of corporate governance, then executive coaching. But my passion, my core passion is really in communications. I believe that I was born to communicate, and that really drives me. I've tried a number of other things so far, but my heart still beats for comms, and after a while I could no longer ignore it, so I had to answer that. In the past, I've co-founded a number of enterprises before AML, worked with fiscal practices, sustainability, and corporate social responsibility consulting firm. Prior to that, I did a lot of work with youth development through Red Strat at the time, now called Red Media, and co-founding that and co-founding the Future Awards as well. Tried my hands on a communications firm primarily for the development sector called Development Diaries. Did that for 4.5 years, and then that was after starting off with television, where I used to present. I used to review books on TV first, called read a book segment on Mind Your Grammar. That was in NTA2 Channel 5 at the time, and then afterwards I went on to do my own show called Youth Talk with Emilia. Yes, that's about it. So let's get straight to today's session. So for today's session, we're going to start with risk communication. What exactly is risk communication? With what is going on around the world at the moment, you would have heard a bit more about risk communication than you would normally hear. I say it's a specialized communication practice, one of the emerging specialized communication practices that we have at the moment, because, of course, of the recent developments across the world. And this is not just about COVID-19. So risk communications has become more popular or has emerged stronger, not just because of COVID-19. It's happened with different things. So, with the recession that happened, with Ebola, with Katrina, the tsunamis, the hurricanes, different activities, different things that have happened from economic to social to governance issues that have resonated across the world. And then the question usually is from the experts is how come people were not forewarned about this? And that's where risk communication comes into play. As a prerequisite, I always like to assume that not everybody in the class understands what communication is about. So I usually just like to start from the basics, and that's what exactly is communication. Conveying information from one point to another, from a sender to a receiver, through the use of a channel, which is the instruments through which the information is passed. And then you hear things like the medium that affects the particular message, and you hear things like channel noise, which is a distraction or an interference with the messaging. There are primarily four types of communication. There's intrapersonal, which is communication that happens within yourself. And those who are very spiritual like to look at this as communication that looks at or talks about you communicating with your creator. But the theorists and the founding fathers of communication acknowledge and recognize intrapersonal communication. There's personal communication, there's interpersonal communication, and there's mass communication. Those are the four major types of communication. Now, when you have established this, then you can look at the different forms. You can look at this different areas in which you can communicate, and you can build and build and build upon that. But just to say that for you to say you have communicated, there must be feedback. People often say PR is a two-way street. I say no, communications is a two-way street. Without feedback, communication has not taken place. If you don't get feedback, you have just completed one end. The return loop hasn't happened, and that's with that schematic diagram that is there. How do we communicate? As we all know, I mean, you develop the message, you deliver the message, you receive the message, you process, understand it, and you acknowledge or respond. This is the full loop that I was trying to describe a few seconds ago, to say that communication really must come full circle. It must go from the sender to the receiver, and the receiver must acknowledge that he or she has received the information or must respond. Now, both ways work, depending on the sort of communication process that is taking place. And then, of course, we look at why do we communicate. Obviously, to build relationships. We communicate for value. Um, when it is a critical element of business, communication does give value. We communicate because we want to or because we have customers. We communicate so that we can achieve success in our endeavors. I'm not sure there's any human being who would say, you know what, I am not talking to anybody. I'm not going to communicate for as long as I live. You can't survive. You can't, even if you are dumb, take it from me. You can't achieve any form of success without communication. Communication also helps to build loyalty, where people want to hear from a brand or want to hear from a person and want to be reassured or convinced that they will offer their support or that they have their support. Okay, what other ways do we communicate? Do we have any volunteers? I'm hoping that this will be as interactive as possible. In what other ways do we communicate? Apart from just sending information back and forth, there's a few other ways. Anybody, if you want to share, you can unmute your mic and share, or you can just type in the comments section so that we can take that. If not, then I'll just move quickly the other slides. Any takers? Okay, I thought I heard someone unmute his or her mic. So I'll just move on. So I have here from Tolushe, giving and getting feedback, dancing. Okay, so now we're looking at non-verbal forms of communication. So there are verbal and non-verbal forms of communication. Everybody places so much emphasis on speaking, as because speaking is the most expressive form of communication. Ade Oba says sign languages. I agree. So there are verbal and non-verbal forms of communication. You can speak, you can sing, you can what else? You can shout, you can let out a sound, you can hum. Then you can use your eyes, your body language, whether you walk away from someone or you stay with that person. You can do different things, right? To to pass on a message. What is most important? What is most important is that you pass on that message. Someone said eyeing. That's an interesting one. Yes, yes. But eye contact is such. I mean, eye contact is such an important form of non-verbal communication, and that is also very easily understood. There's writing, there's formal and informal. Like I said, communication is a very broad subject. It doesn't get its pride of place as it should because it is often taken for granted, and because it is often taken for granted, we run into problems as both as experts and as non-experts because we think that it is easy. Oh, just put out a release. Oh, just say this. Oh, especially now in the era of social media. So you find, oh, just post something, and we are often tempted to want to respond to every issue and to want to participate in every conversation. So very quickly, why risk communications? Risk communications because we're in a world that is currently called VUCA. We're in a world that is volatile. We're in a world that is uncertain. We're in a world that is complex. And we're in a world that is ambiguous. I remember when I used to talk about VUCA, I think one of my colleagues then, Tosin, would tease and laugh at me and say, Emilia, you're always saying VUCA, you're always saying VUCA, you're always saying VUCA. I wish I could, just give her a call now to say, are you experiencing VUCA now? I mean, it is so volatile that any little thing that you do, you never can tell what would happen. And we'll look at that in a case study much later. Then it is uncertain. Truly, we have never really experienced uncertainty as digital natives. If I'd call myself that, as we are now, it is so uncertain. We don't even know for how long the lockdown is going to last. Nobody knows. It's complex because one issue is tied to another. And that's why people or experts will say systems thinking is the way forward now. You cannot try to solve a problem, even if you are using critical thinking, without first clearly exploring how that problem or challenge connects with another. So it is so complex. One, things are so interwoven and so closely related that if you do not unpack them, you have challenges. Then of course it's ambiguous. A number of things are being said at the same time. Multiple meanings can be read to anything that you say or do. How do you get clarity of thought, clarity of messaging? How do you ensure that what you say is understood? And so I just wanted us to look at this a bit. So for complexity, for ambiguity, for uncertainty, for volatility, what do you do as someone who is interested in communication, or someone who is communicating on behalf of a brand, or even as a personal brand or an entity for yourself? How do you decipher this? How do you unpack it? And what should be your approach for each of these? So this is, it's you have the X legend or the X axis that talks about how much do you know about the situation, and the Y axis says how well can you predict the results of your actions. um, so for instance, and I'll just look through this so that we can go to the next one. For complexity, your approach should be, how do you restructure, how do you bring on or develop the specialty that is required for that particular circumstance? How do you build up resources that adequately address the complex situation? Because it's complex, right? It's not supposed to be something that every Sarah and John will understand and will be able to solve. So if it's volatile, how do you build in slack, and how do you devote resources, to prepare ahead of time, because you know that this has blown up or will or can blow up in your face. All right, and that's for want of a better phrase to describe what volatility means. Okay, when it's ambiguous, you want to understand the cause and effect. You want to generate accurate hypotheses around it. You want to test each one to say, if we did this, what would happen? How do we make it clear and simple at the same time? When it's uncertain, how do you get information that you can interpret clearly to understand what the possible scenarios are? So yes, we don't know what's going to happen post COVID-19, but there are three, four, two likely scenarios. It's either the world remains the same, which is highly unlikely, or the world changes permanently, which is more certain as what would happen. Okay, then so what do you do in complex situations? You try to be specific in how you communicate, and being specific does not mean that you have all the answers or everything. When the situation is volatile, you try to be reliable as much as possible. Yes, things might change quickly. It's like a train ride in the amusement park. It goes up and down, up and down. But can you be reliable that, okay, so even though we go up and down, I know that this person stands for this, or this is what this person believes in. In ambiguous situations, you seek to be understood, and then in uncertain situations, you try to build trust as much as possible, because trust is what would make your community or your followers or your publics still have a level of faith in you, to say, well, we're not sure how this will run, but we know that the best decision will be made. We know that you have thought through about the likely scenarios and you know what you're doing. Then we look very quickly at a communication approach, even in a time like this, for risk communications. And the first is the reason. Why are you communicating in the first place? What do you want the public to know about COVID-19? What do you want the public to know precisely? What will the story mean to them? Does it mean pack your bags and run? Does it mean stay put and follow developments as they unfold? How do you want them to feel? Do you want them to be afraid that, oh, we're done for? We don't even know what government is doing, man. We don't have a government at the moment. What do you want them to remember when all this passes away? Oh my goodness, on the day the lockdown was announced, I was so scared. I cried. oh, when I heard about this, I refused to step out of my house. What do you want them to remember? Then, most importantly, the action. What do you want them to do with this information? Risk communication is one that must empower the receiver of the information, or the publics or the recipients, to do something, because you are communicating a risk. You are saying, look, this is a VUCA world. It can be volatile, it's uncertain, it's complex, it's ambiguous. We're trying to unpack it, right? But we want you to, one, stay safe. Two, practice social distancing. Three, we want you to wash your hands as though you are washing away your sins or your mistakes or your wrongdoing, right? What should your response be on that action? Okay, so this approach, the reason, the emotion, and the action, are the three things to consider when you are working or trying to develop a risk communication strategy. Then what else? What then rather is risk communication, and why is it important? It's defined as the exchange of real-time information, advice, and opinions between experts and people who are facing threats to their health, to their economic well-being, or to their social well-being. So, I mean, I know this is a COVID-19 season, so a lot of the things we would hear and say would be taken in the context of COVID-19. But I really want us to look at it beyond COVID-19, to say it could be bankruptcy of a brand. It could be a loan gone bad that has to make a bank merge with another. It could be anything else, right? But how do you exchange, and how do you work around real-time information, providing and sharing and exchanging real-time information as an expert? So the expertise here becomes more important, because in a situation of risk, people want to be sure that the sender of the information is giving authoritative information. So citing of sources, quoting of experts are more emphasized in this whole framework, because we want to be sure that the person who says stay at home knows why he's asking us to stay at home, and not 5 days after we're saying, look, you know what, this stay at home strategy doesn't really make sense because it doesn't help us. What are the features of a risk communications framework that is effective? First, it raises awareness about an impending danger. Awareness is vague, right? So in delving deep into awareness, we're now looking at things like magnitude. We're looking at things like consequence. We're looking at things like uncertainty. In putting that into clear perspective, what's the magnitude of COVID-19, for instance? Is it a Nigerian problem, or is it a global problem? Ebola was an African problem, as it were. Is this a global problem or a local problem? What's the magnitude? How many people how many casualties do we have around the world? What's the consequence? Does everybody who contracts this disease, does he or she die automatically? What are the fatality rates? What should we do? Right? Uncertainty. Well, there's no there's no vaccine for the virus. There's no cure yet, but scientists are working around the clock. So Bill Gates would come around and say, for instance, I'm going to invest in 7 different R&D processes to try and find a vaccine. We might only end up with 2, right? But it's worth it, because even if I spend billions of dollars in the 7, as long as we come up with 2 successful ones, then we must have made some success or progress, right? 2, it clearly advises on the behavioral intent. That is so important, because if you just focus on the awareness, the magnitude, and the consequence without balancing that out with the behavioral intent, then it's not risk communications. Risk communications is one that warns, that foretells, as it were, ahead, that says, look, this is what you need to do so that this does not happen. So it must also clearly advise. It's highly participatory, is what I'm trying to say. It's highly participatory. The behavioral intent must be clear, clearly telling people what to do, when to do it, and how to do it. And the emphasis must remain and be sustained on what, how, and when for people, so that they can join in. It's not about government or WHO, an expert just saying, do this. It's about them knowing, when, how, for how long, what next. Very important. Then three, it must empower people to also make informed decisions based on the magnitude of the risk and the consequences. So what is the informed decision? Do I need to go back home if I am working in New York and there's going to be Hurricane Katrina? Do I need to go back home and work remotely, or do I need to stay in New York because I'm sure I'll be fine? All right. And finally, it must, if it's effective, it must prevent, and here I'm going to add a clause, to an extent, it must prevent the risk from occurring through the corresponding action. So, yes, we're saying we must take our hygiene seriously because there's going to be, in the next few years, as Bill Gates warned, for instance, a prevalence of infectious respiratory diseases or viruses. So, does that sort of emphasis climate change, does it prevent does it, the empowerment you give to people, the information, does it prevent, to at least a great extent or a little extent or to an extent at all, does it prevent that risk from occurring? That I would leave to say, because I'm not sure that we applied risk communication with respect to COVID-19. I know that Nigeria has had a history from Ebola, and this is just dwelling on the health space, from Ebola to Lassa fever, which occurs every single year in the country, and now to COVID-19. But again, with the risk comes, for instance, an agency like NCDC, the Nigeria Center for Disease Control, has put in place, has even been effective in significantly reducing the number of cases of infection of Lassa fever from year to year. Those are some of the things we need to think about. Then, as I'd said, what are some of the examples? Again, so trying to situate this so we don't have our minds fixated on Ebola. An example of the outcome, or what the messaging for risk comes, for instance, would be: how does it help an individual make a choice about whether to undergo a medical treatment or not? Okay, so for hospitals, for instance, you are facing a medical expert, and the medical expert is talking about a possible diagnosis for, say, cancer, which is a terminal sickness. And yes, there's surgery, there's chemotherapy, these are the options. If you do this, this happens. If you do that, you have to do this for this period of time. If you undergo this, how does that help that individual say, you know what, especially if it's an elective procedure? Not all procedures are elective, but if it's an elective procedure, then that individual can make a choice whether to undergo a particular type of treatment or not. Another example would be: will you continue to live next to a power plant, for instance, knowing full well that you may receive the genetic risks that are involved? Maybe a nuclear power plant is too far. Let's look at the lead mining in the middle belt and some regions, or in the northern region in Nigeria, for instance. What's the advice that you give to people about lead poisoning? Do they continue to live there knowing full well the risks that are involved? Okay, then it could also be the possibility of losing a job. I mean, bringing it back home due to COVID-19, or needing to take a pay cut immediately to say, you know what, some airlines laid off thousands of members of staff at the same time. I say, you know what, we don't want to let you go yet, but we need you to consider taking a pay cut. If things get back to normal in 6 months, we can continue. If not, we'd need to let you go. All right. To that something has occurred in the past, such as exposure to harmful carcinogens, and may put the person at greater risk for another health outcome. So how do you communicate that? You know what? Based on the work, for those who work in very strenuous sectors, for instance, to say, based on the work that you did a few years ago, we have noticed this sort of trend from those who have been in similar positions. So you are at risk to developing this sorts of symptoms in future. Again, these are just examples. They can be economic, they can be health related, they can be environment related. But most importantly, I think what the most important thing to take away is that they have to do with a possible change to people's economic, social, economic and social well-being. It must be of importance. The pathway, the risks must be clear. The outcomes, the possible outcomes must be clear as well, so that you can effectively deploy and then advise people going forward. So I just put some examples here: economic impacts, recession, job loss, pay cuts, bankruptcy. Someone who's invested 30 years in a business and is looking at a change in government policy that has the potential to shut down that business. I mean, that's not an interesting thing to encounter. Social impacts, the risk of social exclusion, isolation, the stigma that is associated with contagious diseases and conditions, environmental risk, climate change, a home you've lived in all your life is washed away by water tomorrow. Bushfires and all of that. Then you look at governance issues, protest, coups, assassination attempts. It's here today, tomorrow is it's something else. So these are some of the things that we need to consider and consider very clearly when we're dealing with risk communications. How do these play out? So for instance, play out in real life. For instance, looking at expatriates and returnees. So first, you're communicating that they need to identify high risk countries. They need to be conscious of the fact that there's what is something that is called asymptomatic spread, which means that they could be carriers of the virus without even knowing that they are. Then also at the same time warning them to be conscious about the exposure to their contacts. Then also talking to them about even being conscious with health workers and the places, even if they're trying to get help, that because they're potential carriers, there are consequences that have to do with that. Local contacts, for instance, how do you identify them? Because hey, I don't want any challenges. Then your personal hygiene, and then being reminded that your neighbor who's looking really healthy might be a potential carrier because he doesn't have to show symptoms. Then for community transmission, you're looking at emphasizing social distancing, personal hygiene, and then trying to even let people know that these are the symptoms that you notice for those who will show symptoms. All right, so I just want us to quickly look at strategic communications, because it's such a topical subject, and people try sometimes to say, what does it mean? So here you'll find that strategic communications, people call it policy, specialized, non-profit, public, long-term, and all of that. People mistake it for different things. And there are schools of thought as well that look at this. Some say it must be completely consistent with mission, vision, values to enhance strategic positioning. Other people say the difference between doing communication stuff and doing the right things. Some people say it's about the best messaging through the right channels. Others say set of audience, how a certain audience will support certain objectives. Other people say, oh, it's using it purposefully. Some say infusing communication efforts with an agenda. It's a lot of things, but I mean, because risk communications falls really close to what strategic communication really addresses in a broad view, is why I thought that we should quickly address this. Why did how did we even get here in the first place? To start to say everything that is different or unique is strategic in communications. Because traditional communications, as we all know, is grossly insufficient. Public affairs is no longer trusted. Digital communications for some is just a facade. Hey, what you see online It's completely different from what may be going on, real time. Specialized communications is not foolproof. When people say specialized communications, they now box it to say, oh, health communications, education communications, specialized per sector, specialized for season and all of that. But what is most important is that the concept of strategic communications itself has caused a sort of shift in the way communication is originally understood. And why is that? For three main reasons. One, because the channels have evolved, many more channels have opened up. The dynamics of communication has changed a great deal. I've already mentioned VUCA. Things are, and then speed is now almost top priority, because the capacity to slack on speed, or the mistake of slacking on speed, can really cost the entire process altogether. All right, so again, in understanding what strategic communications is, I say it's a multidisciplinary approach that helps you to achieve empirical objectives through engaging and influencing your stakeholders. So if you look at this diagram, it talks about you as a client, or the brand, or the government, or the person, and it looks at your communication needs and goals, and then it sort of breaks it down through analysis and concept development into the different areas. Again, to say that communication is not about media, communication is not PR, communication is not any of the things that most people understand communications to be. So for instance, when I tell people, oh, I'm passionate about communications, and they say they expect to hear things like, oh, so what PR campaigns have you run? And I say it's not just about the PR campaigns. So when I say to people, for instance, that I consider PR to be boring personally, and again, it's just my personal opinion, and they are wondering, how can PR be boring? Well, so when you break it down, then it now helps you in your implementation, so that you're able to distill what you want distilled through uniquely through each channel to your target audience. And of course, it looks at your results and feedback. So for risk communications, it brings it into better picture, because it's not a one size fits all. It's not, you are dealing with different clusters of stakeholders. As we had seen before, you're dealing with, for instance, if you're looking at a particular socioeconomic class, you're dealing with people who have just returned, you're dealing with people who are here, and then you're dealing with those who are in the communities, because you're looking at three levels or three layers of risk. You're looking at from high risk countries, which is international spread back into a country. Then you're looking at local infections, and you hear in the news when they talk about COVID-19, they try to analyze to say these are the infections. The index case was returned from a high risk country, and then they try to map which is the local infection that has happened, and then the impending danger, the one all of us are dreading, which is community transmission. Because once it's escalates to community transmission, then we're really in for a big challenge. Why is this important? I'll do this very quickly. Because there's increased regulation and frameworks. There's increased stakeholder demands and perception. A lot of campaigns are really short term. There are multicultural and multinational issues that are happening at the same time. There are multiple channels and media platforms that you have to deal with. And most importantly, there's limited professionalism. We're in an era where influencers are the experts. Oh, because I have a following, then I can do PR, I can do comms, I can do this, I can do that. So let's look at an example for COVID-19, for instance. What should be the health communications time in the middle of all of this that's going on? So you have your healthcare providers. I'm starting from the bottom here. You have your healthcare providers, you have communities, you have individuals, you have traditional rulers, you have the private sector, as you've seen, raise, I think they're almost at 20 billion now. You have government agencies and health agencies, you have international organizations, and then you have the policymakers directly. And you see that each of these groups have played very interesting roles. I think the only ones we've not received a press release from so far would be the Association of Traditional Rulers. in Nigeria. We've heard from policymakers, the legislators, they've donated part of their salary. The international organizations are on hand, WHO, I mean, their daily press briefings internationally. There's the government agencies, for instance, the law enforcement agencies who are helping to enforce the stay-at-home order. Then I saw on the news internet, I'm not sure, about the federal government directive to the customs to release all the goods that they had seized in the past, for instance. So there's private sector through COVID, they've raised a lot of money. Individuals are doing fundraisers online, the communities for relief materials, healthcare workers, we all celebrated them, I think yesterday or day before yesterday, the World Health Day, and all of that. So for instance, a health communications framework, these are the different audiences that you need to consider and that you need to deal with. And you can see that it's not an easy pie. So if you break it down, for instance, into this, then you would look at the pyramid. You'd see the grassroots, you see the middle class, and you see the elite, and you see the different channels through which you can quickly get information across to them. And then you also see their reality. So the grassroots cannot afford to stay at home, for instance. So how do you convince them to stay at home? What access? They don't have access to power supply. So if you go on TV and you run all the campaigns and ads on TV, they may never see it. Maybe radio, maybe. For the middle class, they can afford to stay for a while before they begin to panic, because they can see their businesses, crumbling before their eyes. And then for the elite, how do you do that? So these are some of the things to think about. And this is an example of what was used for Lassa fever. So putting side by side what was used for COVID-19, what is being used for COVID-19 and what was used for Lassa fever. I will make the presentation available. I'm also trying to speed up because of time. So do you think that the current communications effort by government, and maybe by extension, or let's leave it by government on COVID-19, do you consider these efforts to be sufficient? What will be your answer? Yes, no, somewhat, far from ideal? Please share in the comments section. We'll just leave a minute for that. Do you consider the efforts so far in terms of communication, do you consider sufficient? And this is thinking about it a little bit more clearly, and not just saying, oh, everywhere I turn there's COVID-19, everywhere I turn there's COVID-19, but trying to think and identify which of these have come from the government. I have received a number of SMSs. A few minutes ago, I got another SMS from the NCDC. Let me just read it. It says, let me just read it. It says, take responsibility, wash your hands frequently with soap under running water, avoid touching your face and high contact surfaces to prevent coronavirus spread. And this came in from my MTN line. So that's from NCDC directly. You'll find that you must have received those messages. This morning I saw a message from NCDC saying that they never said they spent £1 billion on SMSs, because they've been sending SMSs at no cost in partnership with MTN, Airtel and Glo. All right. So in the midst of this, the NCDC is fighting fake news, debunking things that are out there. They are exposing fake accounts that people have set up, even though they are verified, but you still have people setting up, fake accounts to defraud people and all of that. So there's a lot going on. There's a lot, and you can tell that for such agencies, the communication support that they require is really a lot, and it must really be highly experienced people who are manning the emergency operations center, or to ensure that the comms is clear. And we'll come to a case study very soon when we look at where the NCDC has come out to retract something and correct itself, and what that does. Ram Emmanuel, so I'll look at some of the comments I've received. I'll look at them a bit later. I just want us to speed up because of time. Ram Emmanuel says, never let a good crisis go to waste. He was the first chief of staff to Barack Obama in 2008. And what they used the depression at the time, the recession rather at the time, they used it to push forward the Obamacare health legislation at the time. So again, someone like him is saying, look, no matter how bad the situation is, don't let it go to waste. You can always use it if you're strategic enough to achieve an objective immediately or in future. So managing a crisis, what is a crisis? A crisis is a never expected, never planned, never anticipated in its actual measure. Now, what that means is that you may have anticipated a crisis, but it is a crisis when it comes in the dimension, in the magnitude that you never planned for. All right. So I always say that no matter how prepared a brand is for a crisis, there will be one element that spins out of your control, no matter, and that's what makes it a crisis, right? If nothing spins out of your control, it's not yet a crisis. You can still deal with it. Okay. I'm getting some more comments on the question about the sufficiency of the communication efforts by government. We'll go through that when we are looking at the case studies. Okay, so a crisis, and this says keep calm and call the crisis team. I'm sure we've seen this keep calm. We've seen this keep calm. What's it called? We've seen this keep calm GIF still image. There's keep calm. In fact, I won't be surprised if there's no keep calm, but this one says keep calm and call the crisis team. Crisis communication at this point really means that everything you have done hitherto has failed. You have tried to warn people ahead, you have implemented risk programs, you have done everything, and it has failed, which means what you feared most, your worst fear has come to pass. That's what that's what usually happens, with crisis communication. How do you communicate when things have gone bad? I was listening to a podcast yesterday about the deputy chief of staff to President Johnson, Erling Sirleaf of Liberia, and he said for the the crisis that they managed, they had some infections. For 1 month there was calm, and and I pray that doesn't happen in Nigeria. And you know how you feel, we've put this under control. Let's treat those cases that we have. Let's clean up. Let's step up. For 1 month, there was some sort of calm. And then after 1 month, all hell let loose. People started dying left, right, and center. Okay, so they thought they had it under control. And then 1 month after, casualties, this curve, we all talk about flattening the curve. Their own curve just
went 15 hours.
Went northwards. Okay, so what are the different stages of crisis communication? There's a pre-crisis, there's crisis, and there's post-crisis. For pre-crisis, you monitor your risks, right? This is what we've seen, risk communications. How can we prevent it? Should in case this happens, what are we going to do? We're already anticipating. All right, you make your decisions about how you will manage it. You train the people who will be involved in that process. If you're working with outsourced human resource like an agency and all of that, you always check in with them to say, guys, what's happening in the media? What happened to that government? What happened to these people? What if that happened to us? What if that was me or you or us? What will we do? Then during the crisis, you must collect and process information for decision making. But one thing I'd like to add here is urgently. So your capacity and ability to collect and process this information must be at the speed of light, it must be clockwork. It must be fast, because you cannot afford to allow any void or any gap. Then you must create and disseminate crisis messages. Okay, all through that period you must do that, and then you must, at the end of it, when you eventually hopefully get out of it, recover from it, hopefully you assess the crisis management effort and you provide follow-up messages as you need them. Again, this is an introductory class, so I wish I could really go into this, but I would cover all the basics, and then hopefully in the subsequent class we would now go take it one by one. So for the pre-crisis, what's the plan? As I've said, you develop a communication plan with clearly articulated steps and a sequence of action. You build a team of communications experts led by a spokesperson. This may be outsourced or in-house, depending. Then you prepare before the crisis happens. You prepare possible scenarios, using examples in the media. And I always say that a crisis happens all over the world almost every day. Okay, there's always an example, but you have to keep putting yourself there. Oh my goodness, what happened in Spain? What if it happened in Nigeria? What happened with this brand, a brand leader? What happened to this celebrity? What if it happened to me? Okay, then you review. When you take your decision as it's happening, you do your quick prep to say, if we were in this person's shoes, this is what we'll do. Hold on to your thinking and your process and see how it pans out in real time or real life, and then review your practice exercises and say, oh my goodness, the way this has turned out, that means our strategy would have worked or our strategy would not have worked. Okay, so that's the best way to prepare for a crisis. Then during a crisis, what do you do? Communication is almost, the first thing that, even before an actual strategy is put in place to respond to a crisis, it's always, oh, we need to say something, oh, we need to react, oh, we need to let people know, oh, people are asking questions, oh, media journalists are calling, oh, our social media handles are blowing up, right? A line to take is a formal response to a crisis by an organization, a government, or a spokesperson. So in part of your prep stage, you would have identified what is our line to take. Okay, what's the formal response? First, of course, you need to admit that it has happened. Then what else do we say? Pending when we can now share what our response plan would be. Okay, when COVID-19 happened, yes, we heard about it, but from what we've seen, I stand to be corrected. I don't think that the plans, the systems that were in place for Ebola were sufficient for this, because it's a completely different virus. It's a novel strain. People fall ill and they can still move around, unlike Ebola, when by the time you fall ill, you're pretty much bedridden or unable to move around. Okay, so what do you do? Your first reaction is really in 1 to 2 hours. I remember when I first started, talking about crisis communications, I used to, a number of years ago, I used to say, oh, in 6 to 12 hours you must say something. Oh, now it is 1 to 2 hours. In fact, 1 hour might feel like 12 hours in some cases. So you need to respond immediately, and you need to also share new developments. So the P here is plan, check, and act. All right, so the P here is, what are the new developments that will come? So when you are responding, you're already hinting about the developments and the things that you are going to report on the next time you are going to report. Then what are you checking for? You're checking, does my communication answer basic questions? Does it solve people's problems, right? In the way that we are going to respond to this as a brand or as an organization, does it align with our values as a company? What would the action, what would it change? The action that we're going to make, what would it change? Okay, and I often say that LTTs, which is lines to take, are mostly used for non-communication professionals. So for a spokesperson, you may already know what you're going to say. You don't need a script or a full statement to say it, because you're a spokesperson. So you can jump on social media, or you can join Channels TV live at 10 p.m. to debunk something, right? It's your job. You're a spokesperson. But for someone who's not a spokesperson, he needs to be prepared. He needs to be trained ahead of time. He needs to be he needs to have some statements. He needs to have some prep questions, because he's not a comms person, so he's not used to it, right? So they're usually prepared for executives, for business leaders, to ensure that their responses are consistent and are appropriate. And their responses are also mirrored on all the communication channels of the brand, so that it's uniform, right? And then finally, I just want to say, no comment is a no. Gone are the days where we used to say, oh, no comments, not at all anymore. So who is this spokesperson? He's an expert that has the responsibility of disseminating information. He must have a very good knowledge of the subject matter. He must be experienced in managing the media, great charisma. Oh, his ability to remain calm and not grin, but even let out a smile, a reassuring smile, is so important in a time of crisis. He must be clear. He must be firm as well. Firm in responding to things. Firm in not over-promising. Firm in admitting uncertainty. Firm in admitting vulnerability. Right? It's not a political enemies are against us conversation. Oh, this is done to embarrass our government. All those forms of communications by especially public sector spokespersons are a thing of the past. They are obsolete. They should be trashed, and destroyed in the annals of time where they belong. Okay, so a spokesperson was apply balance. What's the balance of information from the government side to the people's side? You can't just come and say this is the government defense to this crisis. It must always put in. You must also put into consideration what are the people thinking, what do they want, and what do they expect? Okay, so what other qualities should this person have? Please share in the comment section. Sorry, I have to do this, but because of time. Okay, what are the response steps? Okay, first, be first. Try as much as possible to be the one that breaks the news and not the other way around. Okay, and if you're a spokesperson, you can, if you have good relations, reach out to media organizations and say, guys, let's break this thing. Break right after, but let me break if you can. Okay, if not, well, try to be first. Now, if a media organization breaks ahead of you, yours must be first in that it must provide an additional information that provides a well-rounded story. So for instance, the way they'll say breaking news, this person has been arrested, details coming later. You as the spokesperson, as the one who's taking charge of the crisis communication effort, you must break to say this person has been arrested because of A, B, C, D, E, and this is why. So you go a step ahead of that media organization that may have broken the news. Be right, be accurate, be authoritative with your information, even if you are uncertain about it, right? But be accurate, be correct. Don't give the wrong information just because you want to respond, and make sure that, for instance, how many people have died so far from COVID-19. Don't say about, as the last count it was 10. Now the last count was 10. You can say last count 2 hours ago was 10. That doesn't mean that before you finish that press conference it will not have increased to 20, for instance, right? Show vulnerability, which makes you credible. Admit when you don't have the full information. I will get back to you on that, or that is still being worked on. Don't attempt to impress the public by overpromising. Okay, show action, demonstrate action. This is what we have done. This is what we need you to do as as our fans. This is what we need you to do as the citizens. This is what we need you to do as journalists. Okay, and finally, listen carefully. Please do not insult the sensibilities of people. Be respectful. When Lagos State placed a ban on Okada, they came out on their Twitter handle, for instance, to say the little discomfort that Lagosians are experiencing. I thought that was a very insulting statement, because millions of people were stranded for a whole week. People missed client appointments, messed up timings, disappointed people, and all of that, because the way they were used to behave, to organizing their life and their time had changed because of that. Okay, what are the other levels? We have issue management, emergency risk, and crisis comes. Issue management really talks about things that are niggling, that have refused to go, right? It's a problem. It's a problem that will continue to linger for a while. The government there's a fraud, a high level fraud in government. If someone has been fired or relieved of his job and has been charged to court, it's a scandal. It's a scandal that would stay on for many months, because you must see through that issue from beginning to the end. And the issue is not just about the scandal, the issue is about corruption. So that's a larger issue, right? So when you say issue management, you're talking about things that spread for a period of time, or that are niggling, that are reoccurring, that you need to deal with until it either goes away or until you bring it properly under control. Now, emergency risk now talks about a combination of things that are happening in the present and still have larger risks that are ahead. So I'm talking about COVID-19, for instance, and in Nigeria, our biggest fear is community transmission, because when community transmission comes, God forbid, is going to be, the death toll will be in hundreds and thousands. And we pray that we don't see that. And then there's crisis where you are right in the midst of it all, in the fire. How do you handle hostile situations? Very quickly. With crisis communications, you will find hostile situations where there would be people screaming at each other, where there will be people hurling insults and curses, for instance, or people arguing back and forth. Please try not to be defensive. So these are just some things. Take full responsibility, articulate how the recipient or the public must feel. Don't judge anybody, don't dismiss anything, don't be defensive. Okay, don't be defensive as much as possible. Then when you move towards the post-crisis stage, you now try to look at what went wrong, from start to finish. What went wrong? The trigger, the spread, the ripple effects, the response plan. You take yourself through this journey to try and identify how you manage this you are evaluating and the impact, and then how that is going to affect what you do next time. Also, quickly, for post-crisis, what do you do in your communication? You address the fire starters, you deflate the crisis trigger, you explain in detail, you provide a human side, you apologize, you show genuine concern, and you say thank you. Because for the people who attempt to point out things to you, you must thank them. Not everybody does that. So they help you, they put you on your toes. Now is the part I have been waiting for, and I hope that we can wrap this up very quickly. Case studies. Lagos State on COVID-19. How many people saw this online? This was very recent, where you had two spokespeople. This is the essay to the governor on the left is the essay to the governor on digital media, Gawat, and on the right is Boyega Akoshile, who is the chief press secretary, and I think essay on media to the governor. And both of them are mocking those who were beaten up and rounded up by soldiers because they went out for exercise. Now, I'm not saying what they did is right, but I'm just saying I think it could have been done better. So please let us know in the comment section as well. Did you see this online? How did it make you feel? Okay, how did it make you feel? The lesson for us there would be, let's try to pass on every opportunity to scold the public, except in extreme circumstances. So for instance, when people are calling the hotline to prank them and to record skits, comedy skits, yes, of course you can scold, but this, I mean, people are just trying to cope with the situation in one way or the other. So laughing at them is really not nice. Again, big issue, Funke Akindele on COVID-19. A wildly popular celebrity actor gets on the wrong side of her fans and the law at the same time. Was it justifiable for her brand affiliations and ties to be severed immediately? I'm not sure, because the way Dito denied and disowned her, it was very quick. And you have that on the left, and on the right you have someone who was really screaming out at her to say, look, I don't know what the heck you were doing. The lesson here, I don't know what you think. Please share in the comment section. Was it justifiable for a brand affiliation and ties to be severed? Please share in the link. I think for me, the lesson here is never take anything for granted as much as you can. Never take anything for granted. The third, Lagos State government on Okada ban. Aha. This happened recently and millions of people were stranded. So this is what I was talking about, the little discomfort. And someone responded, the little discomfort, and then went to, tell the government off. So the perception driver that I see here is overconfidence, attempt to justify a badly executed policy. And this is personal to me. You don't have to agree, please. And the lesson that I learned here is never play down the emotions of angry or vulnerable people. Always acknowledge them. Always acknowledge them. Always. I know that you would say that in this communication, they try to acknowledge it. They say, oh, little discomfort, it will not last. The alternatives being rolled out, but I think they could have done a better job at that. And the third is the Center for Disease Control. When they came out to say, you know what, we said 26, it was actually 25. In my mind, I'm like, what's the difference? 25, 26 is just one. But it shows for them that we are meticulous people. We pay attention to the minutest detail, right? One life is precious. One life matters. So we won't say 26 when it was actually 25. And the lesson there for me is don't be too big to retract or correct an error. Don't be too big to retract or correct an error. Okay? Please share your comments. My question here is, did the difference in one death warrant a retraction? Maybe yes, maybe not. I don't know. Did the difference in one death warrant a retraction? When I saw it, my first reaction was, guys, you could have just let it go. Then when the next death comes, you skip it. And then when the next death comes, you balance out the numbers. But it taught me another lesson to say sometimes, even when your mind wants to push you in one direction, try and do what is professional. My first reaction was, it didn't matter. But then thinking about it, the professional thing to do was done. And I do acknowledge them for that. Finally, Federal government begs Elon Musk. Not quite. Did they beg Elon Musk? We're not sure anymore, right? Perception drivers. We're Africa's giants, right? We dealt with Ebola. We have expertise in handling epidemics. How dare you say that self we don't have sufficiency if I speak English to procure our own ventilators? What do you mean by that? This is Nigeria we're talking about. So they came out, issued, in fact, the permanent secretary issued this full one-page statement explaining. I didn't think it was necessary, but hey, what's the lesson there for us, right? Anybody wants to help with the lesson? Because this one, I'm not quite sure that I have any lesson from it, but I'm willing to learn. So please let me know. What was the lesson there for you? Yes, so Mr. Musk, I beg, don't forget us in your paradise. We need the ventilators. I'm coming out to say, that was a mistake. We actually never said we need ventilators. We know what we're doing. We've mobilized some money. The private sector has gotten involved. I mean, this country has billionaires. What do you mean? I mean, why? You're not the only billionaire. Anyway, those are some of the things that we saw. Okay, so this is also for something for you to think about. In each of these case studies, if you were the spokesperson or the brand manager for Funke Akindele, or I mean, what would you do better, or what will you do differently? I think the climax, the essence of this whole exercise is to say, what would you do differently if you were the brand manager? So I'll look at the questions very quickly. Quite a number here. So Loretta says, yes, I saw it. I don't agree with what they did, but it could have been an avenue to re-educate people again, not to mock or put some form of apprehension again. I agree. You are so right that, I mean, it just makes me afraid that what if I really have a genuine need? These soldiers are not going to listen to me. Sharon says, for a case like Funke's, could there have been a pre-crisis stage? I think most people find themselves smack in the middle of a crisis and try to find a way out. I agree completely. Funke's was, I mean, there was no way you could have prepared for that, but there was a way she could have come out of it faster, in my opinion. Again, it was just a mindless random video share to the internet. I don't think she expected that people were going to react that way. Okay, I don't think so. Then Sharon also says, I agree with your thoughts on NCDC. It's an integrity and perception issue. Yes, certainly. That's like I said, that's a professional thing to do. In my head, my smart Niger sense is like, no, just keep quiet. We'll ignore the next death, then we'll balance out the numbers. Okay. So Loretta also says, on the NCDC case study, I thought they should have ignored the mistake. Oh, really? Yes. that's like your reflex action, right? You know, so he said, I thought you should have ignored it. I was even afraid that people would start to doubt the figures and all, especially with the conspiracy theories flying around. Yes, integrity matters. To be honest, if it was at the tail end of a crisis, then you say, no, the records will remain that it was 26 instead of 25. But we know that they are still testing people, so there will still be more cases, you know. So let's leave it. Again, like I said, my first reaction was, no need, I beg. Cornelius says, NCDC showed integrity in that retraction. It adds credibility to their work. I agree with you completely. For Elon Musk, Bruno says the ministry did the begging, probably an account manager, but it affected the FG as a whole. So again, for the Elon Musk issue, I thought sarcasm, we could have come around it somehow, right? You say to Elon Musk, you know, give it to us, and see if he now responds to say, oh, contact my office, I'm happy to give to Nigeria. Then you can respond to say, oh, you know, we'll be glad to take it off, even though we didn't expect or think that you would consider a request or something. I thought there could have been a way to manage it without necessarily doing that. But again, you need to also review the language. How did the handle that's supposed to be representing the Ministry for Finance, I think, or Budget and National Planning, how did that handle respond? And in an era where this period, this circumstance, I mean, people are looking for information. So again, the timing for sarcasm, the timing for for joking around, and I don't even think that should be condoned in a federal government agency or ministry again. So those are some of the things to think about. Sharon says on Elon Musk, it was in poor taste to do that, and on Twitter they should have gone through the formal channels. Thank you. I also thought that a DM or an email to Elon's office from the federal government of Nigeria would have been it. And to be honest, if we're looking at it from a perception issue, if Jack Ma sent relief materials to Nigeria, I don't think it's such a big deal that Elon Musk sends 300 ventilators. Now, if you look at that situation till now, have we procured that number of ventilators? Well, not formally announced. I've not seen anything like that. We haven't. So could we have gotten it at no cost? Maybe, but I agree with Sharon completely. They should have gone through the formal channels if it was that serious. Then Nkem says integrity and facts go hand in hand. NCDC took the right action. Yes. But the other question, I mean, playing the devil's advocate, the other question to ask is, if they didn't correct it, would we have known? Will we have known? I'm not sure. But that again speaks to what we've been talking about with integrity, that integrity is doing the right thing even when nobody's watching. So NCDC, thumbs up. You did the right thing, even though, we think it could have helped us, just it would have saved us that worry and that fear that, okay, so is this the first time they'll be making that mistake? Has it happened before? Should we be worried? What's going on? But again, it also shows, I think it shows that the NCDC is an agency that under pressure, people can make mistakes as long as they're willing to take full responsibility for their mistakes. So questions, any question? I'm happy to take questions now, and I'd say please unmute yourself to ask so that everybody can learn. I'm happy to take questions now, so that we can wrap up. It's been very interesting for me just observing what has been happening since COVID-19, reading up on the gaffes, learning, following, and listening to a few experts and others who have had things to share in this period, and all of that. So, any question?
Hi, good afternoon.
Good afternoon.
Miss Sharon, thank you so much for this presentation.
Thank you.
I work as a manager at a financial services firm. So I want to find out, I hear all the time that you should have a crisis plan before the crisis actually happens. How can you go ahead to prepare for something you do not know? For example, financial services. Many things could happen in terms of external factors, macro factors. So how do you prepare a plan that will be relevant when you cannot exactly predict the future?
Muted myself. Okay. So when we talk about preparing a plan that can be active, that anticipates, I think it's possible. You may not have the precise messaging that goes with the crisis by the time the crisis happens, but at least you would have a framework that is effective. You would have possible messages that can go, and you would have a clear sequence of steps and actions that you should take. And those are the most important. And I'll give you an example. So for the financial services sector, we've gone round in circles a bit. We've talked about the unification of currency in Nigeria, and the different exchange rates and the problem or the challenges with that. We've looked at the fact that our economy cannot survive only on oil, and if anything happens and the oil prices crash, we're going to have an issue. So again, from financial services, investment banking, and asset management, there are these risks clearly that you can, and I know that risk management is big for your sector. So if you, as a communications person, if you sit with or have proper engagement with your risk team, they'll give you what their concerns are and say, these are some of the things that we're worried about. These are some of the things that may likely happen. These are the things that we don't even want to think about, but for you in preparing that communications framework, you have all of these things in mind. If this happens, this is what we will do. Should that happen, this is what we will do. Now, at the time where the crisis happens, you whip out that plan. And that's why I'm saying that this is just an intro. Hopefully, in subsequent sessions, we would give real scenarios, sector, maybe one or two sectors. When that happens, when you bring out your plan in the middle of a crisis or at the beginning of a crisis, you are not blindsided. You know what to do. However, in the actual statement that you put out, that's when you tweak to the actual messaging to say, okay, so this is about oil prices now being $10 per barrel. So this is what it means. This is what we will do. This is our position on this. This is how we're going to safeguard depositors' funds, for instance. Or this is what we say to our investors, that don't worry, your money is intact. Nothing's going to happen to your investments. The money market fund to say, oh, never mind, it won't affect your interest rate or your return or whatever. So, like I hear you when you say it's difficult to anticipate what actual crisis there will be, but it is the professional thing to do to plan ahead. You remember a few slides back, I'd said that the fact that it's a crisis means you never really saw it exactly as it happens. So as much as you plan, a crisis means there will be an element or two elements that will be out of your control. And that's what makes it a crisis, because you envisaged it, but it plays out slightly different, not exactly as you planned it, but it plays out. Your worst fear, one of your worst fears, do play out. Your worst fears play out, and you have to deal with it. But we must prepare nonetheless. Okay. Any other question? You can type your questions, or you can just unmute yourself and ask.
Okay, can I say something?
Yes, please.
Okay, so
please.
My name is Daniel Kure.
Okay. Hi, Daniel.
Hi. To add to what you said, I think why we have this problem always is because corporates, the public sector, hardly ever have a communication policy or a media policy, as it were. Because if you have a media policy or a comms policy, you know who is your spokesperson. Yeah. You know what to do, when to do nothing. Yeah. As we know, there are times when you say nothing really, when things go bad. And especially in Nigeria, you can actually choose to say nothing. In 2 days or 3 days, it will all go.
Close over, yeah.
Yeah. So when you have a comms policy, that will guide you on what to say, when to say, how to say, and how not to say at all times. That's almost like a blueprint for crisis management. And and I thought to say this again, just an addition to what you said, or the way I see it, risk communication. I think risk communication is a subhead of strategic communication superstructure. Yeah, so it's not a standalone, it's a component of communication that is in the overall superstructure of communication. So when you're looking at communication, you have the media communication, you have the risk communication, you have the crisis communication, all of them, but the superstructure all has them in one. Thank you.
Thank you. Thank you so much, Daniel. I agree. I also agree with, so, I mean, just taking it from what you said, the truth is we don't prioritize communication as we should. And that's the honest truth. And I get this all the time, we don't. It's just one of those things that you think, when it comes, we'll deal with it. Shebi is to call journalists. Shebi is to do this. Shebi is to put out a statement and deny it. Say it never happened. Don't mind those people on social media. They'll just continue to shout.
In fact, to steal this from you, please, let me steal your thunder. Yes. One of the things that I have seen in my years of communication is the fact that people start a journey. Hello?
Yeah, I can hear you.
Yeah. If you ask them, what budget do you have for communication? They will say nothing. They don't budget. Hello? Hello?
Yeah,
Sorry, I'm
I
going.
can hear.
Yeah. So that's the problem. Communication is something that I can call. I'll just go to Google and just ask one or two things, and I'll know what to do. People think communication is DIY. It is
Exactly.
actually
Yeah.
much more than that.
Yeah.
Communication is a science of listening and taking action.
It
It's
is a
actually
science,
it's a
and
science.
that's the part that is lost on a lot of people. That it is a
Yeah.
it's a social science. It's
Yes.
there's scientific processes
Yeah.
and methods to it. But again,
Yeah.
thank you so much, Daniel. So, any other question? Yes, you will get the slides. Christiana says there's always a silent strategy. So again, the trick with silence is you don't want to be silent for too long. Should you ignore things, make sure you are following closely, because you never can tell when it will skyrocket or get out of hand. So closely monitor, closely monitor. But yes, Christiana says yes, there's something like a silent strategy. All right, any other comments? I think we'll just do a summary so we can wrap. It's about an hour 30 minutes now. So the summary of what we've done today, we looked at communications, took an overview of communications, looked at strategic communications and the relationship with risk, and then we looked at crisis communications. Then we spoke briefly about the spokesperson. Who is the spokesperson? What's the qualities, response strategies? How do you evaluate what went wrong? What are the perception drivers? Because for every response or message, there's a driver of the perception. What do you want to be perceived as? What do you want people to think about you? And that's what drives how you respond. Then we looked at case studies: COVID-19 gaffes, Okada ban, NCDC retraction, Funke Akindele, and then next steps. So next steps will be, we'll share this presentation, the resources. We'll share one or two recommended texts as well. For those who are interested, please reach us if you want to join our community so you can receive materials from us, say e-newsletters, case studies as we churn them out. And then hopefully we'll prepare for an intermediate and an advanced training. And this would either be virtual or maybe be a physical session. But there's a lot more to this. This is just an intro. I mean, I just tried to browse through the breadth of it. Okay, but this is really something that is so important and so useful. Then one more question. Let me quickly take this. Christiana says, did Nigeria observe a pre-crisis stage? Yes and no. So yes, we observed a pre-crisis stage based on all of the things we used for Ebola and Lassa fever. But for COVID-19, the virus itself is different from Lassa fever, is different from Ebola. So the government needed to quickly evolve. All they had put in place, all they had planned, was, oh, we dealt with Ebola, this is what we did, and it worked. Oh, we deal with Lassa fever every year, this is what we do. Well, whether it works or it doesn't work, that's left for, it's a subject for debate. But that's all we had. And it's not just about Nigeria, across the world, nobody truly captured this, because the virus in itself is different. So we've dealt with a lot of other diseases, respiratory infectious diseases and the rest, but never one quite like this. And that's why you had a lot of, so I didn't even go into busting myths, about whether it survives in temperate or humid regions, whether it's for black or white people, Caucasian people, whether it's for young or old babies, all of those things. There are certain circumstances around the crisis that fuels myths, and we can look at that maybe at the next session and now understand why we seem to have a lot of those myths. And the biggest myth that's been discussed now is the 5G myth, and that, I have something to say about that a little bit later. So thank you so much for joining the session. Thank you everybody for your time. Thank you, Daniel, for sharing of your experience. Thank you, Sharon, for asking questions. Thank you for all the other comments that I can see pouring in through private chat, and to everybody. Thank you so much. It's been my pleasure doing this. I thoroughly enjoyed myself, sharing my thoughts, learning, and really looking at those case studies. There are many more, but we had to pull those ones out. We will continue to observe and see more case studies as they as they happen in the course of COVID-19 and even afterwards. And these are Nigerian case studies. There's so many case studies, especially in the UK and the US, based on President Trump. So many interesting case studies, but we just thought to localize for this session. So thank you so much all for coming. We look forward to seeing you at the next webinar. Thank you. And to the AML team, thank you so much for your support. Rosemond, Dimeji, Runo, and every other person. Thank you. See you next time. Thank you. Have a good afternoon.
Well done, Emilia. You did a very good job.
Thank you so
Keep it up.
much.
Well done.